I'm Dr. Juyia from Elite Women's Care, where we provide gynecology-only services. And today we're going to talk about endometrial ablations.
Dr. Juyia, is an endometrial ablation considered a major surgery?
Endometrial ablation is considered a minor surgery that is outpatient. Most women can expect to go home just an hour or two later with minor cramping, usually controlled with Motrin.
What can I expect on the day of my procedure?
The day of your procedure, like with any outpatient surgery, you can expect to be recommended not to eat or drink for a couple hours prior to your procedure. You'll be asked to arrive at the procedure center, either the hospital or outpatient surgery center, a couple hours in advance. You'll get an IV. You will meet your anesthesiologist and your nurse, and then just prior to surgery, I'll again come by to review all your paperwork and make sure that we're both in agreement on the procedure planned for that day.
When can I get back to my normal routine?
An endometrial ablation is treatment of the lining of the uterus. There's many ways to do this, but the NovaSure is essentially a burn of the lining of your uterus. So while abnormal discharge that can be light or watery, just like from any burn, might take a few weeks to resolve, usually full recovery other than the discharge is within 2 weeks, and women are often able to return to work in just a couple days to their usual jobs without restriction.
What are the potential side effects?
An endometrial ablation generally is with almost no side effects, meaning it's intended to burn the lining, and you can expect decreased bleeding in almost all cases. In some cases, women will have no bleeding at all following an endometrial ablation. Side effects to be considered, though, is that a scarred uterus is more difficult and unreliable to sample in the future. So women have to be low risk for endometrial cancer.
When can I expect my normal menstrual cycle to return?
An endometrial ablation is a non-hormonal treatment of the lining of the uterus. Since it's a burn with no hormone, your cycle is never interrupted. It can return just as was planned. If you were scheduled to ovulate soon, you will. And then that's when you'll start noticing what your new bleeding pattern is like, meaning you should notice less or no bleeding. To learn more about endometrial ablations and have an office consult, please contact our office either by phone or on Facebook.